Hi, I'm Arthur Evans. I'm the Chief Executive Officer and Executive Vice President of the American Psychological Association, and I want to welcome you to the first panel of the day. This is on climate's impact on mental health, and we have an outstanding group of people who are going to be sharing with you what they know about this topic. Um, at the American Psychological Association, we are very committed to understanding and using psychological science and knowledge to help address climate change and the impact that it's having on individuals. One way that we're doing that is using psychological science to look at how that science can help us understand issues like cognitive bias and how to shape messages so that people are more likely to follow through on policy and other suggestions around how they can affect climate change. But the other way that we do that is by looking at the impact of mental health, looking at the impact of climate on mental health. I'm originally from the state of Florida. My wife's from the Bahamas. And over the last few years, we have seen a really significant increase in the number of really significant storms. And in fact, a couple of years ago, you may remember that there was a really significant Category 5 storm that went over the Bahamas, in particular the islands of Grand Bahama, where my wife is from, and Abaco. It was devastating. I was there in the immediate aftermath, and not only was there a significant amount of damage to the island, the physical plant of the island, but there was a real significant mental health impact. The level of stress in the aftermath of a Category 5 hurricane, where many people felt that they were going to literally die in that storm, and living through that, the fear, the anticipatory fear about what's going to happen next, all of the stresses related to whether I build my house back where it was, where do I live, what do I do the next time a hurricane is a significant hurricane is coming. All of that kind of stress is having an impact on the mental health of the nation. And so we're going to have an opportunity to think about this topic. We have an outstanding group of people who are going to explore this with us. Their bios, their full bios are in your materials, so I won't go over that, but I will introduce them. And then each of them will speak for about 6 minutes, and then we have the opportunity to hear from you, hear your questions, comments, and we'll have our panel to respond to that. First up will be Dr. Wael Al-Delaimy. He's a professor at the University of California, San Diego. Then we'll hear from Joshua Gordon, who is the director of mental health of the National Institute of Mental Health. And then we'll hear from Dr. Susan Pacheco, who's a professor of pediatrics at the University of Texas McGovern Medical School. And so first up, Dr. Wael Al-Delaimy.
Thank you, Arthur. I want to build on what Arthur mentioned, and really every climate change health impact, whether it's physical or impacting the environment, has a mental component. So whether heat waves leading to more aggression, or flooding and wildfires leading to despair and depression from loss and trauma, like Arthur described, or drought leading to suicide among farm workers, and anxiety of the unknown future, like you just heard. And there are vulnerable populations to those mental illnesses, including and specifically those with pre-existing mental illnesses. Fishing communities, farmers and rural communities, minorities, and first responders are at higher risk. But really, we need solutions, and we can't address mental health specifically without addressing the bigger problem of climate change and its risk factors. We definitely need better mental health care systems to deal with this mental illness tsunami that is in the making. So let us have a thought, and I want you to reflect: what would a bishop, a politician, a clinician, a physical scientist, an activist, a social scientist would have in common. And on the face of it, nothing, because each one of them has a different perspective, professional profile, and maybe background. But in fact, they all share this planet that they all need to live on, and they all care about their health and the health of their loved ones now and in the future. And this is also reflected in the summit, where we see panels focused on health, other focused on faith leaders, on advocacy, on politicians. So that is really reflected in this combination of background. And that is the basis of the book we published in less than a year ago. And we had psychologists, physicians, healthcare providers, faith leaders, social advocates, climate scientists, health scientists, air pollution modeling experts, biologists, and politicians, all together writing their chapters on what are the solutions in line with the focus on health, human health, and in relation to planetary health. And so in that book, we had several sections, including a section on living organisms and species extinction and how they relate to climate and health, the climate and air pollution impacts on health, the water, agriculture, forest situation, and their relation to human health. Then we had sections by different groups, by bishops and faith leaders, by clinicians and physicians, including a chapter on the psychological impacts of climate change and how we can deal with it, the social justice components of climate and health. And then we also had sections on specifically just solutions by engineers on energy, renewable, but also by politicians, state, federal, and international policies that would address the health impacts of climate change. So as such, this book is really can be used as a reference and a benchmark, and it's freely available. We made it freely available as evidence, as science that would drive action. And the vision we see for this is some committees formed across the nation that would have those people in background, and implementation of proposed actions and policies that you would do for an intervention, implementing the change in behavior and momentum. We just heard from the White House advisor how the administration is going with policies top down, but we also need from the bottom up, from the grassroots effort, and to kind of increase this effort and momentum that we can have or make a difference. Now, some might say, well, this is too much to ask, and this is not going to happen. And I can tell you it has happened in public health. The secondhand smoke was banned in 1994 in California. But in the 70s, nobody would even think or dream of banning smoking indoors. It is totally against the social norm. Physicians were smoking, everybody was smoking indoors, and there was no kind of social norm about it. But now it is totally unacceptable. So it took a couple of decades. We also saw with COVID-19, within just weeks, we changed our behavior, and we stopped the air pollution, we stopped the communication because we were forced, the transportation. And so we can do it, but we need a paradigm shift. And as part of this effort, I have put a Google Doc link to the profile that we have for my session to get ideas and input from everyone how we can move forward. And I think we have a lot to do, but there is definitely a momentum to do that with this current environment. So I want to hand it to Josh, and thank you.
Thank you, Yael, and it's really a pleasure for me to be here today. I am, as Dr. Evans mentioned, the director of the National Institute of Mental Health, which is the principal federal agency responsible for research into mental health, covering everything from causes to treatments and all in between. When we think about climate change, we think first and foremost of the myriad effects that the environment has on individuals' mental health. And we think of both the individuals with serious mental illnesses and the bulk of the population, which is going to have adverse and at times overwhelming mental health effects from the stresses of that we anticipate in the context of climate change. So first, I just want to give you a very brief primer into what our understanding of the environmental effects on mental health are, and they really are myriad. It's important to recognize, though, that the environment has both potential risk factors and potential protective factors. And it's the combination of these risk and protective factors that lead to mental health outcomes, both adverse and positive mental health outcomes. And I point out this positive because I think, Yael mentioned one of the things we really want to try to do is meet the challenges of climate change, and building resilience is one of those primary methods that we have to do that. So if we think of, in general, environmental exposures as being potentially leading to risk and protective factors, what can we think of for climate change? What do we see as the challenges that climate change brings to the table for mental health? One was already mentioned by Dr. Evans, and that was the potential adverse consequences of particularly disaster events that might occur in the context of climate change. There are also slower and more insidious ones, the kinds of changes that are going to be occurring or that are already occurring in our community that affect our daily lives, that will eventually affect where people can live, and the economic and food security issues in our lives. And so when we think of the compound effects of climate change, we must think about disasters, yes, and the immediate stressful effects, but also increased stress on financial systems, increased stress on food systems, and the impact that has on individuals' mental health. We know that these mean increased risk factors: economic insecurity, housing insecurity, food insecurity, migration. These are all risk factors for adverse mental health outcomes. There are also potentially protective factors therein, provided that we can allow people to develop resilience, and that requires meeting their ongoing needs for financial support, for food support, for housing support, but also creating a community that provides social supports in the context of climate change. So those are some of the effects that we can anticipate based upon what we already know lead to adverse mental health outcomes and promote resilience to those outcomes. There's additional information that we don't yet know, but we probably have the capacity to predict. We need to understand what the overall magnitude of the impact of climate change will be on mental health. And we need to know precisely where those impacts will be felt. I say that's predictable because thanks to the fantastic modeling that's done on the climate change end, we kind of know where people are going to be affected most. We know the communities that will be impacted most. And what we need to do is then extend that modeling to include predictions about mental health effects, primarily risk factors, but also those protective factors as well. And we need to be able to understand, therefore, where to devote resources to build resilience and to counter the potential or predicted increase in need for mental health services. There's one other aspect of climate change that I want to mention in the context of mental health that I think we really need to focus on, and we need to understand that climate change is going to affect the most vulnerable amongst us more. And when I say vulnerable, I mean it in many of its myriad consequences. We know that it's going to affect minority communities most because they are inherently have less of the financial and food and housing security resilience that communities need to be able to withstand the consequences of climate change. We know that lower income countries that don't have the wherewithal to sustain the support for for resilience efforts are going to be most affected. We know that coastal communities are going to be most affected, or that communities that rely on normal patterns of water and agriculture. So we can recognize that there are vulnerable communities amongst us that will need the most attention, and that unfortunately, these vulnerable communities include communities that have been the subject of racism in the past, that have been the subject of unfair policies and practices that create mental health disparities in the first place. That is, disparities in access to care, disparities in quality of care, and disparities in outcome. So we can recognize that the climate change is going to create risk factors. It's going to create opportunities for building resilience, that we need to be able to understand and predict these opportunities and these potential risk factors, and that we need to ensure that resources are devoted, particularly to vulnerable communities around the globe, to minimize these impacts. And with that, I'll turn it over to Susan. Thank you.
Perfect. Thank you so much, Josh. So let me share with you, I am an allergist immunologist, and I've been in academia practicing for over 25 years. And you may ask, well, what is an allergist immunologist doing in this group? But I really think that preserving mental health is the most important task that we have to accomplish in the battle of against climate change. So I'll be talking about children, knowing that children, they don't happen in a vacuum, and they what happens to their adults, the adults taking care of them, also impacts them. However, the problem or the issue with children is that they're still developing, and we know that events that happen in early life can affect their future. Now, in my practice, in my personal life, I've seen many things since I've been working with this. And in the protests that I've seen, and I want you to think about the load that this imposes in children, but in the protests that I've seen, children are anxious, children are angry, or adolescents are anxious and angry because of what's happening. And I've seen a 7 to 8 year old boy after Hurricane Maria, and I'm from Puerto Rico, crying not only because he doesn't have a house and he doesn't have food, but also because he's concerned about what's going to happen to Puerto Rico. And that's a heavy load. After 3 months of no electricity, I've seen young adults start shaking and crying after sudden loss of electricity. And patients of mine, right after Hurricane Harvey, were coming with depression, nightmares, clinging behavior. They were not able to sleep. They didn't want to go to school. So we have two problems, I think. And one of them is the so-called eco-anxiety that APA describes as a chronic fear of environmental doom. And that happens because of many reasons. Children can see what's happening, children hear the news, children participate in marches and protests, and they feel also that they're being let down. And the other thing, we know that there's a recent poll by the Kaiser Foundation, and over 50% of the children said that climate change make them feel scared and make them feel angry. Now, if we don't pay attention to this, we'll have the behavioral changes, some of which I mentioned, but we also have mental illness. And we know there's very clear evidence that displacement, extreme weather events, and even air pollution are associated to adverse mental health outcomes, including depression. And we've all heard this anxiety, irritability, aggression, violence. And in Puerto Rico, for example, after Hurricane Maria, the number of suicides increased in the population, and over 7% of children met clinical standards for PTSD, and I'm sure that this is an underestimate. Now, why is this important? Children are developing, and this is a lifelong exposure. So the most important thing I want to mention briefly with you is what can we do? And there's a tight balance between being realistic and honest, and at the same time offering support, hope, and resilience. Now, there's things that, we have advocacy, we have policy, the government can do that, medical societies. However, there's some very basic things that can be done at the individual and community level that can make a difference in the life of children. And when I say community, I talk about faith groups. They're key in helping our children, teachers, sports teams, coaches, because it's a multi-systemic problem and it cannot be tackled only by the health profession. And many times these groups are first responders. So we need to build resilience. And one of the things that is very powerful, other than allowing kids to vent and express what's going on with them, is to allow them to bring alternative and solutions, at their own level, what they can do to be part of the fight. As adults, we can promote connections, and this has been shown to be very strong at the level, a personal level, and the community. And we can train and engage these different groups, because many times these are the groups that are going to be first responders. So we need to educate ourselves, we need to educate others, and work for preparedness and strengthen the links that we have in the society, even before and after the events, because many times we're prepared, but in the aftermath, we don't know what to do. And many of these individuals don't know where to go. So there's a lot to be done, and this can be an overwhelming problem. However, I am very optimistic that there's things that we can implement that will make a difference in our populations. Thank you.
Okay, great. So that was a great setup. We already have some questions coming in. And so we're going to go to some of our audience questions. And the first one is for you, Josh. The question is, Dr. Gordon spoke about building resilience in the context of climate change, a critical need. Resilience is both a personal attribute, psychological resilience, and a community attribute. Could you speak, could the speakers address the links between those two levels of resilience and how they might each reinforce each other? So we're going to start with Josh, since he kind of put that out there, but any of our panelists can address that.
Well, thanks for that question. I think I'm going to address the mental health aspects, but there are many aspects to resilience in both the community and the individual that one needs to think about with respect to climate change. For the mental health resilience on the individual side, we're really talking about building in the individual a sense of self-efficacy, a sense that they have a role to play in managing their own mental health, and teaching that individual coping skills to be able to make it through periods of challenge. Those are not universally or 100% protective, but those can increase an individual's own resilience. The community plays a big role in building individuals' resistance, because it's through many community programs that we can build individual resilience, but there's also resilience at the community level, creating social structures to support community members and to ensure the continuity of community-based programs is one particular crucial element to build a community's resilience in terms of helping itself and helping its members ensure their own mental health. Many other things to talk about. Those are my first two thoughts. Happy to hear the other panelists as well.
Yes,
Well, okay, I'm so sorry. Go ahead.
I'm sorry, I can comment on that, because we are doing actually work on resilience among refugees and traumatized refugees, Syrian and Somali. And we found that children with high resilience were less likely, significantly less likely to have mental illnesses. And so this is just published actually today, I believe. And then we also looked at resilience among local Somali immigrants who still have trauma. And we went in depth and found actually the community resilience is more important than the individual resilience. So we could learn from these communities. We can learn from indigenous populations as well, Native Americans that have had resilience in dealing with a lot of adversity. So this is an area that definitely could help. Sorry, Susan, go ahead.
Oh yeah, no, and basically that's the same. The community is key, because many times the communities first responders, right? You go to your church, you go to your pastor, you go to the teachers, the schools. So it can really make a difference. We cannot rely only on the government, on the health community, because many resources are not there, in particularly for vulnerable populations. They don't have access to this. But at the individual and community level, it's very, and there's evidence, scientific evidence for this, that very simple interventions can make a difference and can help a child move forward.
Very good. I'm going to ask another question. I'm going to paraphrase it a little bit, and I'm going to add to it. So the question is about many of the causes for mental health concerns that we've been talking about are a result of acute episodes like hurricanes or intense kinds of events. But what about the longer term climate change issues that are also having an impact? And what I want to add to that is this idea of how do you connect the dots for the public? So, for example, if you live in a community where if you make a living by fishing and the fisheries have been depleted because of climate change, the stress that you're feeling is ultimately connected to climate change, but it may not be connected in the minds of people who are experiencing those things. So, sort of a two-part question. How do we think about the longer term impacts? And then also, how do we help connect the dots for people so that people understand that in light of climate change?
Go ahead, Josh.
I can respond to the first part, perhaps, and maybe one of the other two might be better to respond to the second part. We know that slower, longer term stresses actually create different kinds of adverse outcomes than acute ones, right? So if we have an acute traumatic event like a hurricane or automobile accident, we tend to see post-traumatic stress disorder, and we tend to see, varying levels of resilience or recovery from that. In the context of a slower stresses, like say decreased economic or food security that evolves over longer times, that can be actually even more damaging to the brain and to the body. That's where we see the chronic effects of stress reveal themselves in terms of greater rates of depression, greater rates of substance abuse, greater rates of anxiety. So I think we have to be on lookout for both kinds of mental health responses. And unfortunately, they are synergistic in a bad way, in the context that if you are already, your brain and your body already is afflicted by these chronic long-term stressors, and then you're hit with an acute stressor, unless, again, you've built the right kinds of resilience, that's going to lead to greater incidence of PTSD and more severe consequences of that acute stressor.
And the other thing is we need to educate the community. We need to educate ourselves, because many individuals are not aware that these things are happening. So we need to educate ourselves and the community so that when we create initiatives, those issues are addressed. Now, the other thing is that I'm sure you've seen this with COVID. There are a bunch of articles that says, well, if you're feeling this way, it could be because of this reason. If you feel like you don't want to leave your house, I'm sure that you've seen them. And many times I read them and I find myself there and I said, I feel this way, and I'm not immune. So maybe a similar approach for these chronic effects can make a difference to help our population so that they can acknowledge I'm feeling this way because of this reason.
Yeah, we definitely need some communication and evidence-based approaches that will appeal to the lay people. It's not technical jargon. It's not in journals, peer-reviewed journals. We have to make these, and that's a challenge. And I think that's why we're not getting as much cooperation from the general population, or apathy about it, or lack, because they don't see that. So this is really a task that we need to do in terms of advancing this. Otherwise, we're not going to make this paradigm shift and change unless we get there.
Okay, we have a specific question for Dr. Gordon. This is around NIH funding, and I guess NIMH in particular. funding for this type of research. Can you speak to what your plans are about that?
So in the past, most of our funding in this area has been around, the effect of disasters, traumatic events, and ongoing traumas and stress, around range of levels from basic biology through to clinical studies, including resilience building. But we don't have a lot specifically thus far focused on the effects of climate change. I think we can anticipate that changing. As you are well aware, the new administration has expressed its priorities in this area to be a true all-of-government approach. They have proposed specific funding for the National Institutes of Health to support biomedical research related to the health effects of climate change, and we can anticipate that will include mental health. So I think there's opportunities coming down the pike to really focus in on how to address the mental health impacts of climate change in an effective way.
Josh, I have a question for you. Can you comment? Can we extrapolate from the information that we have in other how people behave in extreme disasters? Can we make or crisis can extrapolate and implement those tools to the current situation?
I think we can, and I think there's enough evidence, especially, again, if we're talking about the slow chronic change versus the acute traumatic disasters. We've learned a lot from acute traumatic disasters about how to intervene and safeguard. So that's probably where we're a little bit stronger in our evidence base. I agree with comments that you've all made that we need to develop or build our better evidence-based approaches to building community resilience in the longer term in the context of these less acute stressors that we can anticipate being exacerbated or being caused by climate change. And I think the other aspect of it that I think we probably need a greater evidence base is the ability to reach into these particularly vulnerable communities with solutions that work for them. We have invested some in community-based research around health disparities, and I think those investments are going to need to be increased in order to respond to the threats of climate change as well as many other threats that these communities face.
Okay. This probably will be our last question, and I'm going to take, it's sort of a combination of two questions. So one person asked about, Dr. Pacheco talked about preparing the first responders, which is very important. Someone else asked about emergency departments and how could emergency departments and hospitals mitigate the mental health effects of events, from acute events, I should say. So just sort of thinking about sort of first responders, the ability for the nation to have an infrastructure that can respond to the mental health impacts of these kinds of disasters. Do you all have any thoughts about what that infrastructure might look like, and how do we prepare our mental health infrastructure to be able to better respond to these kinds of acute mass events that are having these kinds of massive impacts on people's mental health?
It's a tough one, right? That's very challenging, and I really I've struggled with this because government can do, but we all know that health is not a priority in the climate conversation. Now we can make it a priority, and we can bring out, that's our role as in the leadership position. We can bring out that these are needs that the communities will face. However, I think that we need to take the initiative at the community level, at the individual levels. We cannot wait for the government all the time. We cannot wait for the research to be there. But there's very simple things that we can do while systemic initiatives are undertaken. I don't know what my colleagues have to say about this.
I also agree. I don't think it's going to be helpful to wait to deal with it, the emergency room, although health systems are going to fail, just like it failed with COVID-19, unless there's preparation for it. So that's part of the health administrators component. But in terms of dealing with it at the population level, it has to come from a community level intervention. And there are many good interventions out there in terms of preparing community workers or community mental health workers. The Promotora model in Latino kind of communities is a good example. Technology, is also one way to deal with it and try and address this burden. So we definitely need to think differently from the usual way.
Great. And that will be our last question. I want to thank, and if you all could join me in thanking a really outstanding panel, Drs. Gordon, Pacheco, and Al-Delaimy. I think the takeaway from this discussion is, as the conversation and more attention is paid to climate change, that we have to think about its impact on our health and in particular our mental health. And our panel has raised some of the issues there, that there are both negative impacts, but we also need to be thinking about how we create resilience and build resilience in communities, both at the community level and at the individual level. So we have a lot of work ahead of us. And what I hope is that for individuals who have some influence over who's at the table when these conversations are happening, that we make sure that we're thinking about and incorporating the mental health impact because it's so important for the overall health of our communities. So again, thank you again for our excellent panel, and thank all of you for joining us today.
Thank you.